So welcome, I'm Amy. I'm the Assistant Branch Manager from the main library, and we are going to do Info Nuggets with Amy, Gale's Health and Wellness database. The format for today, we're going to do about, I would say maybe 25 to 30 minutes of a presentation, followed by 10 minutes of questions and answers. I tend to go off on tangents fairly easily, or very easily, so it's best if the questions are at the end of the presentation. And so as they occur to you, feel free to go ahead and type them into the chat box, please. So the Info Nuggets segment, if this is your first time joining me, this is a weekly segment where I will introduce you into some of our wonderful digital databases that we have. I'll show you how to access them with your library card, and I will also give you a tour of some of the search features that are in there and how to work with some of the results that you find. So we're always interested in hearing what you would like to learn about. So also feel free to put in the chat box any future resources that you'd like to learn about during a future Info Nugget segment. So let's go ahead and get started. Whoops. I'm still getting used to this piece of software, so bear with me for a moment. Okay, we are going to go ahead and get started on the library's website, which is www.sjcpls.org. There's a couple of things we'll need to take a look at before we actually get started. Whoops. First of all, you will need a library card in order to access this resource. If you don't already have a library card with St. Johns County, you are able to get an instant e-card. Once you click on that, fill in the information, you'll get a card number. Be sure to write that down because you will need to enter that later to access the database. Some other things that I'd like to point out here on our home page, our upcoming events page. If you click on that, it will show you some of our upcoming Facebook Live or pre-recorded events that we have coming up. So for instance, right here, this is today's Facebook Live event, and if you were to click on the description, it would give you the link to the website where you'd be able to watch today's event. We do have some other fun stuff coming up for the foreseeable future, so take a look at those when you get a chance. Another thing that I'd like for you to know about is over here underneath Explore, we have an Ask a Librarian feature. So if you ever have any questions for library staff, you can still communicate with us even though we're closed by text, chat, or email. Go ahead and click on any of those, ask your question, and a library employee will get back to you. So let's go ahead and get started on seeing this database. So let's go ahead and hover here where it says eLibrary, and then we'll go down over to Databases, click on that. And we have a very, very long list of databases because we really do have just about 30 million different databases that we subscribe to that you can access from home. The one that we're looking for, and these are in alphabetical order, is the Gale Health and Wellness database. You can go ahead and click on that. And here we go. If you're accessing this from home for the first time, right around here it's going to ask for you to type in your library card number. You can go ahead and just type that in. It will be right around here. Now there's a couple of different things that I'm going to go over with you today with the Gale Health and Wellness database. We're going to talk about their hot topics section. We'll see how to do a specific search, and I'll also show you how some of the advanced searches work in here. So first of all, I think the health topic that's on everybody's mind right now is the coronavirus. If we scroll down a little bit, we have topics of interest, and the first one on the page is about the coronavirus. So here we can go ahead and click where it says explore this topic. And it gives us a nice overview of what a coronavirus is, and if we want to get some more specific information on this particular coronavirus that we're all experiencing now, we can click here on Read More. So this goes over how there are a variety of different coronaviruses, and how many of them, well, we have some that have been first identified in the mid-1960s, and there's 7 known human coronaviruses, and it talks a little bit about each of them. One of the things I really like on this page is they have a section here on the latest statistical data on the COVID-19 coronavirus pandemic. Some of these links you might have already seen, but as I was going through this, I found some things that were new to me as well, and I want to point them out. The one that I really liked on here was the coronavirus update from Worldometer. We're going to click on the link for a moment, and it gives us a little disclaimer that this is a third-party website separate from Gale, and we'll go ahead and click on Continue, and it will bring us to it. So it has some information, a broad category of worldwide what's happening. And then it gives us active cases and closed cases, and this is the part that I thought was most interesting. So here under closed cases, it gives us cases which had an outcome, either recovered or discharged, globally 80%, or unfortunately deaths, which is at 20%. If we scroll down even further, it gives us a nice chart, country by country, of some really good statistical data. And we can even click on a particular country, like the United States, and it gives us even more specific information from state to state. So it can kind of show you how different states are comparing with their responses, or with their experiences rather. So here's Florida down here. And this is just a great place to go to because we're hearing a lot of numbers being thrown around, but this is a good all-in-one resource for some strong data about what's happening here and what's happening in other locations as well. So I'm going to go back to the database, or to the Health and Wellness database, and we have some other good statistical websites here to look at. One of them that I was taking a peek at earlier was, I don't even know how to pronounce, Genomic Epidemiology, where this one, I opened it up and I said, whoops, this one's a little bit over my head. So they have a range of levels depending on your experience, and you can see right there, it's got a lot of data, and this one kind of shows you the spread of how the virus is spreading and the transmissions. But you'll see that they have information here that's geared towards, the average health consumer and people with a little bit more experience. So as we scroll further down, we have some definitions between the different types of coronaviruses, like SARS, MERS, and here's the COVID-19 down here at the bottom, which gives us some good, solid information that sort of defines the differences between each of them, talking about transmission, prevention, what a high-risk group is, and what steps that you can take to stay safe. Furthermore, symptoms, diagnosis, treatment, and drugs that are presently being developed, and vaccines that are presently being worked on. What I also like about this page is at the bottom is it gives you your list of resources. So if you want to go and find further information about some of the data, you can just go ahead, scroll down to the bottom, and then click on any of the links. And this is something that's pretty important. When you're doing health information online, you want to see where they're getting their information from. So this is a list of the resources that they've used to create this particular article. Now this one's just a broad overview. Let's go ahead and click the back key and see what else we have on here. So it was just not this little article, but when we scroll down, this is where we get a lot more information. The Gale Health and Wellness database divides their information up depending on the type of resource category. So we have reference, magazines, videos, images, audio, news, and academic journals. We'll take a look at each of these. So reference, let's click on this. Reference typically means it's something that either appeared in a printed book and has been digitized for this collection, or it's been developed specifically as a digital resource for the Gale Health and Wellness Resource Center. So here we have something on the coronavirus from the Gale Health and Wellness online collection, and it has some related topics like the cold from the Gale Encyclopedia of Public Health. Here's something on SARS, also from that same encyclopedia. And general information on pandemics, and this is from the Gale Encyclopedia of Emerging Disease. Let's take a quick look at this one. So this is an actual print resource, the Encyclopedia of Emerging Diseases, that has been digitized for this collection. Over here it gives us a fairly good description on pandemics, origins, histories. And what I also like about these is it gives us key terms. Frequently with medical information, there's a lot of terminology that I don't know about you, but some of these things I'm unfamiliar with. So it breaks down the key terms, kind of giving you a glossary to what it is that you're reading about. And it defines some of these unfamiliar terms for you. Here it's breaking it down by demographics, public health role, and then it also gives us some viewpoints. So I'm going to click the back button once more. We'll take a look at some other things. Let's go back up a little bit. So we'll go to this one again, the COVID-19 coronavirus. And, oops, actually I'm sorry, this was the page we were just on before. Let me go on to the one underneath it, the regular coronavirus. And it also tells you right up here who the author is. And whenever you're doing medical research online, there are certain things you want to look for, and an author or an organization that takes responsibility for the research is very important. That's a little bit of a red flag. If you're finding health information online and it's not telling you either who wrote the article or what organization provided the data, like I said, that's a big red flag. You might want to keep looking until you find something else. Now within this article, we have some really useful tools that we can use as we're doing some of our personal health research. One tool that we have right here is a translation page. So this will actually translate this article into a different language if you'd like to share it with somebody else in your family, or maybe you need help reading it. Now, as a heads up, the translation feature isn't perfect, but I think it's enough where it can give you the idea or help you translate it. And it says right here, translation accuracy is not guaranteed. If you've ever used like Google Translate, you'll know exactly what I mean. You get the gist, but sometimes the grammar isn't perfect. But here we could click here on, let's see here, and there we go. So we have it in another language. I'm going to hit the back button a couple of more times. Whoops, I think I hit it one too many times, guys. Let me click on that once more and go back. Okay, what we can also do, some different tools in here, is font size. So if this is a little too tiny for you, you can go ahead and increase the font size until it's something that you can more easily read. We also have a feature on here to listen. This is an automated audio translation, so it's going to come out kind of a little bit robotic. Whoops, that was a little loud. Let me see if whoops, I'm hitting wrong buttons again. Trying to see the volume control here. I'm going to turn this down a smidge because it was a little loud when I tried to play it. But if you need to listen, if it's easier for you to listen to something than to read it, you do have the option right here to go ahead
Coronaviruses, abbreviated COVS,
and listen to something. So that was the listen option. Over here we have a few more tools. This is a link to Google Drive. If this is an article that you would like to go ahead and save, maybe for later, you can click on this link and it will take you to your Google Drive account where you can go ahead and sign in, and save it for later. Similarly, we have one for Microsoft right here, so if you have a Microsoft Cloud account, you can go ahead and save it there. And if you'd like to email it to somebody, you can click on the email link and email the document to somebody. It gives you the option to type in the person's email address with your name so they know that it's coming from you. And you can edit the subject line and type in whatever message that you'd like. You can either send them the full text of the article or just the citation, and then go ahead and click on send. And what we can also do is if you want to download the article, you can also do that as well, where you just hit the download button and then indicate where you'd like to save it on your device. Other tools that we have are located at the top of the screen. This is something that I love for students, be they K through 12, or maybe it's an academic student. It will do the citations for you. I don't know about you, but when I was doing different source citations in college and high school, I didn't have a computer that did it for me, and this was usually the worst part about doing a paper, was trying to decipher how to do a citation. They offer it in several different formats. You can do it in MLA 8th edition, APA 6th, or the Chicago style for 17th edition, where it just automatically formats the citation for you, and then you can go ahead and copy and paste it directly into your paper. And you also have some export options if you are a student. Some popular citation managers, we've got Noodle Tools, EasyBib, RefWorks, again Google Drive, Microsoft OneDrive, or an RIS format, which can be used with EndNote, ProCite, Reference Manager, or Zotero. So built-in citation tools, which are pretty awesome. Again, we have another link where we can send it to either via email or Microsoft OneDrive or Google Drive. Another download one, print. If you've ever tried to print from anything online, you know sometimes the formatting can get a little crazy. So if you ever see a print icon embedded within the website or something that says printer friendly, that makes life so much easier because it will make sure that it's formatted exactly the way it should be for when you print it out, so you're not wasting a lot of paper. You can also get the link. So if you need to link back to a particular article, you can grab the link from there. And another really cool feature is you have the option for highlighting and making notes within the article. So if I wanted to highlight this, I'm just going to highlight it with my computer. And I have the options here for highlighting or notes. So I can click on highlight. I can even choose the color that I want. And if I want to make notes, something like use this later, and save that, it will save it up here automatically in my highlight and notation section of this database. So when I click on that, it will show me exactly what I've highlighted and what notes I've made. So if you're using this database for homework purposes, these are some fantastic tools to help you organize the information that you're finding. So that was the reference portion. Let's go ahead and take a look at magazines. So as you'll see, we have 617 magazine articles regarding the coronavirus. It automatically sorts it by relevance, but we can do it by newest articles or oldest articles if we'd like. Now magazines are going to be geared pretty much towards the layperson or the consumer. There is a difference between magazines and academic journals. We'll take a look at these later. But here under magazines, it is defaulting to full text. If we wanted, we can go ahead and click on consumer health, because if your medical knowledge, I mean, like me, half of this stuff sometimes I can't even pronounce. So consumer health is kind of the level that I'm at, where I want to read something that is definitely written towards the layperson. You can also specify if you want it to contain images. You can click on that, and it will include those. And they even have an option if you're looking for articles that are in Spanish. Whoops, let me try that again. And it will bring it to you from different Spanish resources. Other things that we can do is if we wanted to filter our results by subject, excuse me, it will give us some suggested related subjects where if we wanted to narrow it down a little bit or find some related topics, we can go ahead and, whoops, wrong button. We can also filter it by document type, where if you wanted something that was specifically maybe an interview or a personal account, we have a whole bunch of different types of documents that we can use. Financial reports, recipes, travel narratives, and they are organized by largest to smallest. We can also filter by publication type. If there's a particular resource you'd like to see an article from, you can go ahead and indicate it in here. We also have sections. If you were looking for a specific portion, whoops, somehow I got on news, I'm sorry, but while we're here, so if you were looking for a particular section from a newspaper, you could go ahead and say you only wanted articles about coronavirus, maybe from the sports section, to see how it's affected the sports industry. Publication type, we can put it, or publication date rather, we can put in a specific date range. So if you only want articles that have come maybe from the past week, or maybe from early in February, maybe you want to see what sort of news was out in February. Let's try that out. So let's say we wanted something maybe between February 1st and February 15th. We could apply that and see how many articles we had. So from newspapers, we have about 607 that came during the first couple of weeks in February. And to get rid of that one, I just clicked on the little X next to it. Now another feature we have right here is search within. So if we were looking at these news articles and we had 17,000 and we said, oh my goodness, that's a little too many for me to go through, we can go ahead and search within those results. So if you wanted to, here's something that I'm always interested in. It's another one of those words I can't pronounce, but this is something that I've been reading about, and it's both scary and interesting, where it talks of, so here we have 23 articles that include that topic as well. So that was under news. Let's go ahead and take a look at some of the other resources. Videos. We do have some videos in here. So here we have some from the CDC. And we have some from the New York Times video collection. They're very short, brief snippets, but they tell you some very concise information about particular subjects within coronavirus. Images. This is useful if you are a student and you're doing a paper. This is where you'll find any sort of charts or graphs that you might be able to use on your topic. We also have audio options. We can click on that, and it will give us audio news stories. The majority of these, I believe, are from NPR. Let's go ahead and click, take a look. Okay, so yes, this came from NPR's Morning Edition, and it's the actual broadcast. You can go ahead, click here, and play the audio. And it has a full transcript of the interview right here as well. So I'm hitting my back button. Now let's take a look at the academic journals, since we already kind of got a sneak peek at the news. So academic journals will be your professional medical publications. We have an option here to narrow it down to just peer-reviewed journals. So these are articles that other medical professionals have looked at before the articles were published. It's one thing for somebody to publish an article. It's another thing to have another professional read an article before it's published. And in the instance of the coronavirus or other medical conditions, you typically do want to look for some peer-reviewed journals. However, since it is coming from a medical journal, it does mean that the medical language is going to be pretty intense. So, for instance, let me click on this one. This is from the Journal of Environmental Health. And let's see, it came out This is how good this database is. This article came out in May 2020. So we're getting stuff that's being published, included in here, that either hasn't hit print yet or it's something that they released a little early. So let's go ahead and click on this article title. It gives us the volume number, the issue number. It tells us who the authors were, who the publisher is. This one's a fairly lengthy article. But you'll see here, like within the summary, that they're using, this is geared towards the medical professional. I mean, the language in here, and it looks like it might be perhaps even a study, maybe. And they're citing their sources left and right, which is a great sign. But again, items that are peer-reviewed, that's something that you typically do want to look for when you are doing some intense medical research. Something else that's fairly new to the Gale Health and Wellness database that I recently noticed is they have what's known as a topic finder, where you can discover topics and results that are related to your search. So if you're doing this for maybe homework purposes, or maybe if you're trying to find some other keywords to research, this is a great resource for trying to figure similar terms or some subcategories. So here we have a whole bunch of different terms, categories. We could click on this, and then it will divide it even further. Maybe clinical trials. And it will also give us links to the results over here on the right for some different articles. So we can click on this, and this is an article that came from the Canadian Medical Association Journal, and it came out last week, April 14th, 2020. And it gives us the full article. And over here on the right, it's giving us some other related materials and some related subjects as well, where you can go ahead and click on any of them and it will expand the information. So that was simply browsing through Gale Health and Wellness's hot topics or their topics of interest. Typically, though, when I'm using this resource either for myself or for a library patron, I'm looking for something very specific. Let me go ahead and type in the example, migraine. I know a lot of people who suffer from migraines. I myself used to a lot more when I was younger. I think as I've gotten older, my chemistry might have changed a little bit, so it's not as bad as it used to be. But I am still interested in different articles on migraines. So here again, it gives us a reference item. This is from the Gale Encyclopedia of Alternative Medicine. Even tells us the volume number and which edition it was and when it was published, 2020, where you can click on it and it will again give you a pretty exhaustive summary of everything pertaining to your particular issue that you're looking up. But because migraine has a lot of results, again, I could do search within, and I have the strange experience of ocular migraines. And here it gives me an article just on ocular migraine. So I started off with a broad topic, and then I was able to narrow it down by typing in a couple of more words. And it went ahead, and here's a specific article regarding that. And when you type things in, it will give you different suggestions as you're typing them. So for instance, when I was doing migraine, it gave me some variations. Because a lot of medical terms, let's be honest, the spelling on them isn't always what you assume it's going to be. So it's helpful that it gives you some suggestions as you're typing something. Let's also take a look here in the advanced search. Now this is useful to really help you define what you'd like for your search strategy to be when looking for health information. And you can also say from the outset, like, you only want things that are peer reviewed, you only want things that were published between a particular time period, or you only want things that are a certain type of document. So you can put in all those search parameters from the beginning. You don't have to filter down from a big pool of results. You can just tell it, this is what I want. What I also like about this is a publication search. So this is something good for the healthcare professionals out there. Trade publications are notoriously expensive. You can easily be hundreds of dollars for a one-year subscription to a specific medical journal. What you can do here is sort of work around that, where we can list all of the publications contained within this database. And we've got close to 1,800 different medical publications that they're pulling articles from. You can do a specific publication search. Let's go ahead and put in the migraine topic, see if there is a journal specific to different migraines. Well, this is interesting. So there's a brain circulation journal. Let's go ahead and click on that. And it's something that's published by MedNow. I'm going to click on the title. And here it tells me the details about this database's subscription to this journal, Brain Circulation. It's got full text coverage from 2016 to present. It's a quarterly magazine, so only 4 issues are coming out each year. And here, when I click on this drop-down arrow, it gives me the years since 2016. So if I wanted to click on 2018, I've got links here to the various issues. Or I could just click on this one, and it will go ahead and display the articles from that issue. So if you have a subscription to Brain Circulation Journal, and you're paying a couple of $100s a year for it, this is one way for you to access issues from a very specific publication with your library card at no charge. And here is that article. It's the full text of the article. Another thing that I do want to also point out about this database, let me click on the home page, is it's not just for medical terms. You can also put in specific medications. For instance, one of the ones that I'm on and a lot of people are on, lisinopril. If you want to find out some more information about a medication maybe that you're currently taking or something that your doctor recently prescribed, this is coming from the Gale Encyclopedia of Prescription Drugs. I can go ahead and click on that, and it will give me information about the medication and tell me more about what it is that I'm taking. And again, those key terms. Again, with medicine, there's so many times you'll come across a word and you've got no clue what it means. Here it will go ahead and define it for you. And this database is great because it's not just for regular medications. You can also put some homeopathic things in here. So for instance, lately I've been hearing a bunch about elderberry. And I click on that. It's going to bring me some resources, some herbal drugs. This is from the UXL Encyclopedia of Drugs and Addictive Substances. Let's do this one. Elder, Care Dex Alternative Medicines, where I can click on this. And here we go. Elderberry, it's another term. So it tells me what this is. Oh, and even here on the right, here's a link, the Gale Encyclopedia of Alternative Medicine. Let me click on that and see what we have. This was something that was published, again, 2020, the Gale Encyclopedia of Alternative Medicine. Goes down, and we have a whole bunch of information about various homeopathic medications, or not medications, but homeopathic items as well. So it covers a gamut from what your doctor might prescribe to what you might find on the shelf over near the pharmacy. So thank you very much for joining us, and I hope you enjoyed my new theme song. I know I certainly did. Um, let's see here. If there are any other programs that you'd like for us to do, or any other electronic resources that you'd like featured on Info Nuggets, please go ahead, indicate in the chat box. I'm all ears. And I will be here next Friday. That's May 1st at 3 p.m. I'll be talking about the BrainFuse database. They have a Job Now portion on their database where there are resume templates that will help you write or edit a resume. They have interview coaches on there, and there's a skill surfer portion where you can build different skills. And I'll show you all those things. We are doing Facebook Live adult programming every weekday from 3 to about 3:45. That's Monday through Friday here on our Facebook page. And this session will eventually be posted on our YouTube page. So thank you everybody for joining me today. I'm really happy that you were able to come. And I'll see you guys next Friday, May 1st, 3 p.m., where I'll be talking about BrainFuse. Thanks, guys. Have a great day.